Resolved the first problem. That's great.
Thanks, Ben.
Thank you, Ben. Thanks, Lou. Sorry, I know that this is your first live, and we've got you on board, and then all of a sudden there's technical difficulties made you run about. But thank you for doing that.
That's fine.
We've just explained a few things to people. So if you want to tell us about yourself, so you're a midwife. You also run your own business doing antenatal classes. The difference being you do on a one-to-one basis, which is amazing because well, I'll let you explain what you do and how you do it.
Can you hear me okay?
Perfect.
Brilliant. Yeah, so I'm a midwife. I have my job in the NHS, which I do during the week, and I work in a variety of different hospitals. And then the business is one-to-one antenatal classes. So antenatal classes for first-time parents, refresher classes for those who already have children. I also do birth reflections, and that's for anybody who feels upset or traumatized by their birth experience and want to talk about it. And I also offer postnatal support. All my classes are one-to-one, so I go to the couple's home at a time and date that suits them and do the class there. So the advantage of that is that we can completely tailor it to whatever their needs are. So if they've got a specific birth plan or specific worries or fears, we can just tailor it completely around them.
So I'm a father. My little baby's about to turn 21 next week. And I remember...
Not so much for a baby.
He still is. He still acts like one at times, bless him. Hope he's not watching live. So I remember going to antenatal classes as first off, and I was only 21 at the time. And it's quite intimidating walking into a room where there's loads of people around and that sort of stuff. I know a lot, there's benefits to it. A lot of people have some friends from it and they stay friends for a long time. But for me at the time, it was, I just wanted to get in and out. I just wanted to learn quickly and get out because it was so embarrassing and stuff. Doing a one-to-one basis would have been great for me at that time because then I could have felt more relaxed. And, you know, the same as this, being able to ask questions from afar, it's a lot easier. So as you go through with your people, what do you discuss throughout? So let me just go back a bit. So the actual session that you do on a one-to-one basis lasts how long?
For first-time parents, it lasts about 4 to 5 hours. Depends on how much chatter goes on. Often the chatter goes completely talking about lots of other things going on in our lives. So it takes about 4 to 5 hours, but we take it at their pace and we have lots of breaks. For a refresher class, it's about 2 to 3 hours.
Okay.
Because a lot of the postnatal stuff and care of the baby, they've been through that and they're the experts. So they just kind of want to refresh pain relief and kind of the process of labour. So it varies for couples. I mean, I've been in people's houses for longer than that if necessary, if they've needed that time. So it just depends.
You say refreshers. I had another child 4 years after, and I needed to go back because you do forget, and it's nice just to remind yourself about all of those different things. And it is, there's so much to know, and you forget so much stuff as well the second time.
But also things change really, really quickly. You know, sometimes in the obstetric maternity world, policies and procedures and what we do changes really quickly. So between one baby and another, things could be completely different. How we do things could be completely different. So
So if we move on, I've got a little script here I'll just keep looking at just to keep us on track and make sure that we're all good. We've had all the technical difficulties, so that's good. We got them out of the way now.
They're out of the way, I hope.
So we're going to be talking about antenatal, postnatal and birthing reflections, all quite important things to be able to do. We'll go through them in stages. So if we start off at pregnancy, as soon as someone finds out that they're pregnant, what should you be doing and what are the stages that you go through from start?
Well, the first thing to do is to be really happy. It's an amazing thing to be pregnant. The most important thing to do is you need to book in with your midwife as soon as possible. So most hospitals now will have their own website and they'll have an online referral form. So whereas in the past people used to have to go to their GP and the GP would send a referral form into the hospital, that's kind of gone away now. So what the hospitals want you to do is to book online through their website, and that means you get access to a midwife and your first scan far quicker. We need to have women booked by the time they're sort of 10 weeks, really, ideally 9 weeks. So whereas, you know, again, in the past, people might not have only just found out they were pregnant around that time, and certainly don't want to tell their friends and family they may be pregnant, but their midwife needs to know, we want you in, take your bloods early, take your history early, and then you'll have your scan after about 11 weeks.
Lovely. it is a big thing, isn't it? That first scan is a bit of a changing moment as well. I remember for me, the first time that because it's not real, although you kind of think you are pregnant, you are having a baby. It's until you go to that first scan, which is really emotional as well, isn't it? It was
It
like,
is,
I
yeah.
remember because that's for me, just for me, and obviously I'm a bloke, and that's, you know, I have to go through nothing at all. But I remember the heartbeat and all those different sorts of stuff, and it's just like, oh my word, that is like, this is real now, and it kind of changes everything, and it's nice. It's a big step, isn't it? Everyone gets to that 12-week step, and that's where they kind of have the scan, relax, and then start to tell people, as you say.
Yeah, absolutely. It is a big marker. And I think seeing that baby on the screen for the first time, I think, is a reality check for both parents. I mean, obviously, if mum has had quite a few symptoms of pregnancy and is feeling quite ill, then I guess the whole thing's quite real to her already. But yeah, it is a lovely moment to see the baby on screen and to hear the baby's heartbeat for the first time. Yeah, it's
Yeah.
lovely.
Can I, this is quite a good time actually to ask, so Rebecca Sessions, who I think is still watching, she runs the physio specialist clinic in Wheat Hampstead. So she asked a really good question earlier, which fits in nicely actually with what you were just saying. So she said that she treats a lot of pregnant ladies as a physio, and she always tells them if they don't feel the baby moving as much as usual, then they should get checked out. And they often say that they're worried about using up their midwife's time, because obviously time is precious, especially in the NHS. But Rebecca says she always tells them that midwives want them to get checked out. And so Rebecca's just asking your views on that.
Absolutely, Rebecca's absolutely right. We want to see women. We are there for you. We're there to look after you and your baby throughout your pregnancy. And you can have all the scans in the world and all the monitoring of baby in the world, but actually they're just screening tests. They don't give a predictive value to say that the baby's going to be okay then later that day or the next day. The only real way we know how well your baby is by the movements. So a baby is happy and healthy will move lots. A baby that may not be as happy will conserve its energy, so therefore it'll stop moving. So our advice is, yeah, absolutely, if you haven't felt the baby's move. So what we look out for is either a decrease in movements, an increase in movements, or a change in the pattern. And if you experience that, then please just get in touch with your local hospital, your triage, or if your hospital doesn't have triage, to the labour ward. And don't kind of think, oh, well, I'm seeing the midwife tomorrow, or I'll see how it is tonight. We want to see you straight away, really. If you're concerned, maternal instinct kicks in really quickly when you're pregnant. You might not even realise. And if you don't think something's quite right, then please come in and see us and let us check you over and reassure you that everything is okay.
You are very reassuring. I'm just thinking, if you were in the delivery suite with me, I'll be like, oh my word.
Oh, thank you.
Well, no, but it's still quite a daunting time, isn't it? And it's just kind of like, you're very soothing. Will make me feel it
Oh,
is.
thank you.
So if we just move on then. So during pregnancy, when people come to you for the first time, what are the first sort of fears or worries or concerns or bits of information that they actually want?
Well, I guess most people's fear and worry is about labour and what will happen. Although I always say to everybody that actually it's the next 18 years you really need to worry about, and the labour is just a small part of that. But it's usually kind of the whole process. It's what to expect, what's going to happen, what your options are, what your different methods of pain relief are. So there's lots of different worries that people may have. And so the whole idea of my classes is to go through their worries and their concerns, and hopefully by the end of it that they feel reassured and they feel happy and they have all the knowledge that they need to help them through the process.
Yeah. You never really have. I keep saying this from a boy's point of view, and I'm sorry, but I can only talk from my own perspective.
Okay.
You're never really prepared, though, are you? You can do all the best in the world, and it's. I remember, you know, I went to all the classes, did everything that I needed to be able to do, and it's just once you get home, and then it's like, right, okay, now what do we need to do? No one can prepare you for sleep deprivation. It's the most amazing feeling in the world, but it is also one of the hardest. Definitely. So if we talk about, sorry, I'm just looking at the next question that we've got. So it's actually, funny enough, it comes around not preparing properly for childbirth. Is there any sort of information that you can get from anywhere at all? Is there any sources? Because nowadays everything's all online, but we're so lazy, or if it's not there in a click, we want it straight away. Is there any good sources of information that you can go to that you recommend?
Absolutely. My favourite website is NHS Choices. I think it's an absolutely brilliant website. It's kind of evidence-based. It's no nonsense. It just tells things how they are in really clear, plain English. And I think it's, if you need to look something up, that's the one for me that I always kind of go to look up things. I think it's the one that everyone should be using, rather than you can read all kinds of horror stories on Google. But it's a really good one. And it also has a symptom checker on there as well. So if you or anyone in the family is feeling unwell, you can go through the symptom checker and it will kind of give you help and advice there. There's also, most hospitals on their own website will have lots and lots and lots of information about various different parts of pregnancy and information for pregnancy. So your own hospital's website is always a really good place to have a look as well.
Yeah, it's just that, just reading a few of those comments. Caviar's come on, not hi Caviar, how are you? She was just saying, where were you during my pregnancy? I think during my labour. I think that's I think I reiterated that point. You are very calming and very good. Hi Sue, thank you for joining us. Hope you're well.
Hi Sue.
I was just going to say, I am trying to note down some of the important points that Louise is saying, and I'm going to put them in the comments at the end, all the websites and things like that. So, and also Louise kindly wrote a little blog article tips for us last week that we put out on the website for getting prepared for childbirth. So I'll put a link to that as well at the end.
Do you want to just run through some of those tips that you put out there that you can give out to people? Yeah. Sorry to put you on.
Will I remember?
That's all right. We'll just send the link afterwards, and then we'll make sure that we're good to go with that. So yeah, so we've covered the sources and stuff that you should do. Is there anything else that people should be doing? And I know we sort of talked about it before, but just going from the pregnancy, contacting midwife, doing the different stuff. Is there anything else sort of tip wise that you would be able to give to people to say this is kind of essential for you, really?
One of the things that's really important is to make sure you go to all your antenatal appointments. If somebody has a more high risk pregnant, or maybe more problems in their pregnancy as such, they may end up with lots and lots of different appointments, which can be really frustrating. But every appointment's really, really important. Every appointment is an opportunity to check that you and your baby are well. And it's also an opportunity for mum and dad to ask any questions that they have along the way, just to reassure them that everything's okay. So attending antenatal appointments is really, really important. And of course, attending your antenatal classes is very important.
That's it.
And they are really important, just to make sure that you do have all the help and support and advice you need, and you know your options and you know what you want for childbirth, and it helps you to write a birth plan. And lots of people think birth plans can be quite controversial, as in some people feel that they never got them out of their bag, or the midwife never looked at them. But I think it's always really important to have a kind of plan of what you'd like for your labour, just an idea, and that you and your partner have talked that through. Because when women in labour, they're very vulnerable. And so sometimes they can't often speak up for what they want to do. And so it's really important that your partner understands what, you know, you've talked together about what you wanted, so that your partner and hopefully your midwife is that advocate for the woman as well in labour, and just making sure that she's looked after and kind of getting the experience that she wants.
Yeah. Good. We've had a couple of questions coming.
I was just going to say, and it's on labour as well. So thank you, Danielle, for filling that nicely. So this is from Danielle Wallington, who's Milk and Fizz and Milk and Beers.
Hi, Danielle.
So she's asked, are you seeing an increase in women hypnobirthing during labour?
Yeah, there is an increase of women using hypnobirthing during labour, but they can use hypnobirthing for all different scenarios. So I've known women who've gone for elective cesarean sections, and they've actually used their hypnobirthing to keep them really calm throughout the process, and to keep them kind of focused on what's going on, because obviously having a big operation is a really scary time as well. So yeah, there are lots of women using hypnobirthing in labour. Yeah, absolutely, it's good. It's all just about deep relaxation and positive thinking.
I was just going to say, could you just give a bit more detail on hypnobirthing?
I have to say, I'm not a hypnobirthing teacher. I'm not trained in hypnobirthing. I need to kind of make that clear. But yeah, it is kind of about the kind of positive mind and changing your mindset to knowing that you can do this, that you are in control of your body, and to help to keep you focused and keep you relaxed during labour.
And having you in...
If there's any hypnobirthing teachers who want to say anything else, please do. I don't proclaim to be a hypnobirthing teacher, but I do talk about it in my classes, just from a very basic kind of level. But yeah, I think it's really good.
We did have another comment come in from a Gemma Matthews. I think she's a fan of Leah's, who mentioned Leah's book. So Leah, like most people don't know, Leah wrote a book on maternity leave. So she's an employment solicitor
Yes.
by trade, and wrote a book all around sort of the world of maternity leave and all the legal rights and those sort of stuff. So it's available on Amazon. I'll send you the link so I get paid for it. No, joking. But yeah, if there's any questions that people need to know about maternity or anything like that, then feel free to contact Leah afterwards. She is a wealth of knowledge regarding that.
Literally just the legal side, though. No practicality at all.
But very important, really important to know though. Lots of people don't know their rights, or they don't know what their rights are in labour, in terms of their maternity leave and what time they can have off work and what they're entitled to. Lots of people don't understand that.
And it adds to all the extra pressures that's going on as well, because it's a difficult time, isn't it? And you know, trying to work out everything that's going on around as well. How are you going to be? How long you got off? What can you do? All those sort of plans that can go through.
Yeah, and it very much depends on your employer, and well, Leah will know this better than me, how long you've been employed with your employer, and you know, the kind of job you have. And sometimes it comes down to individual choice. There are some women that are quite keen to get back to work after they've had a baby, and other women want to take that time off, and so it's completely individual to women about how they feel and what they want after they've had their baby as well.
Yeah, good. I was a stay-at-home dad for a little while.
Oh, really?
Well, I worked shift work, so I was with the kids a lot of the time on my own, and it was it's hard. It's hard, you know, and especially as I know that we have the whole male-female divide and stuff, but it was tricky. I couldn't wait to hand the baby over and just be like, I just need an hour to myself.
Aww.
I just need an hour. So yeah, loved it though, absolutely loved it. So we are moving on to. I've lost my little track now, so
That's okay.
That's all right.
so I just need to flip the messages come through from Gav. Yeah, so once we've gone through pregnancy, we get home. Any sort of tips around that sort of area? How people feel about that? What they need to know? How to stay in contact with a midwife? What happens after that stage?
Well, what should happen is being transferred to community midwives should be an automatic process. So even if you don't have your baby in the catchment area of your hospital, we have systems set up that we can email your local hospital to let you know you've had your baby and that the midwives need to come to see you at home. So hopefully that's usually a seamless process. You will be given phone numbers of the ward, so, and the time you should have seen the midwife for, or certainly heard from them. So if you haven't, it's really important you do phone back to the ward just to say, I haven't heard from the community midwife, just in case there has been a breakdown in that communication. But hopefully usually it's quite a seamless process. But I think my survival tips for the first week has got to be trying to sleep when the baby does. Because when the babies are born, they're actually prolactin, one of the hormones that produces breast milk, is produced in high levels at night time. So the baby is going to want to feed at night time. Even if you're bottle feeding, the baby's still programmed to want to feed at night time. So if you try and stay awake a day and try and sleep at night, it's just not going to happen. So you've got to try and sleep when the baby does, to try and kind of negate some of that sleep deprivation. And so it comes down to, if you've got visitors coming round, that's absolutely fine, but they need to be coming and hopefully doing stuff for you, making you a cup of tea or bringing you around something to eat. And if the baby goes to sleep, it's about you saying, look, I've got to go to sleep, baby's asleep, because those visitors won't be there at 3 o'clock in the morning, and and you maybe won't with your baby then. So it's about looking after yourself as well. And the second tip is analgesia, pain relief, pain relief, pain relief. Because if you're in pain and you're tired, then the world is just a really horrible place. Depending on the delivery you've had, some hospitals are getting less and less likely to send you home with paracetamol, which is a really good thing, because paracetamol costs you 16p in Tesco's or any other supermarket.
Yeah, we're not allowed to advertise. Other supermarkets are available.
In supermarkets. But for the hospital, it's really expensive to give out packs of paracetamol. So for things like paracetamol, ibuprofen, I recommend that everybody has them in their house for after you've had the baby. You can't take ibuprofen in pregnancy, but you certainly can after you've had the baby. And for women who've had, say, caesarean section and need stronger pain relief, the hospital will send them home with that stronger pain relief. And I think for that first week, you should be taking the analgesia really regularly as prescribed, just to kind of get through that first week. And then after that, because so much happens with the milk coming in and, you know, just kind of day 3 when your body just realises what it's been through. And it's often day 3 that the adrenaline you've been running on takes a nosedive, the milk hormones take a surge, and often women get what we call the 3rd day blues or the baby blues. But that's quite hard going. The milk comes in, whether you're breastfeeding or not, the milk will still come in. So that first week is really tough going. There's lots happening. So I think the 2 top tips I've got is try and sleep when the baby does, take pain relief. And actually the third one is to let your family help, because it doesn't matter how old you are, you'll always be your parents' baby. And they're going to want to help. And so if they want to come and cook for you and run the hoover around the place or put some washing on or whatever, just let them do it, because you do need help in those first few weeks. So if you've got people around you, then yeah, take advantage of them.
Definitely, I totally agree with that. And I would, if you want to bring food around, then do that. Feel free. I definitely recommend taking advantage.
Do that for me anytime.
If anybody wants to bring food around to me now, that'd be great.
We've had a few questions come in.
Yeah, so one from Rebecca is on birth reflections, which I think we're going to go into in a bit of detail in a minute. Yeah. But Danielle's asked a nice one, which is, what's the best part of your job?
Oh gosh, there are so many nice bits of it. It's really nice getting to know a couple throughout their pregnancy, and then especially if you get the chance to deliver their baby, or certainly seeing them just after they've had their baby, that's really magical. And if you just looked after somebody in labour, those first few moments that baby's born, there's nothing like it. And I don't think it matters how long you've been qualified. Seeing a baby being born, it never gets boring. It never gets, oh, it's just one of those things. It's always just amazing, because you watch a couple become parents, and it's really magical. So there's loads of bits of my job that I really like. I really enjoy postnatal care and making sure, seeing women if they're struggling with breastfeeding and watching them, spending that time with them, and then the baby finally gets on and breastfeeds and stuff. And yeah, there's lots of different bits of it. It's most of it I enjoy, really. It's a brilliant job. I really can't imagine doing anything else.
It's an amazing job. It must be so rewarding. I'm sure that there are, like everyone's job, bad bits that go with it, the long hours, all the rest of it, but rewarding. It must be an amazing thing to be able to do. Have we had any other questions come in?
Rebecca has just said if she's ever lucky enough to have another baby, she's booking you out for 9 months.
No problem, Rebecca, I'll be there.
But in return, you could get some good physio. So
awesome. Yeah, I have been seeing Rebecca already for my gammy leg. So yeah, that'd be really helpful.
So if we move on to birthing reflection, yeah. So let's reflect. So what does birthing reflections entail?
Yeah, sorry. And Rebecca's just specifically asked whether you get any of the hospital notes as well.
So birth reflections is all about women who feel a bit upset or traumatized by or even just confused about their birth experience. So
oh, we're frozen. Are you still there, Lou? Sorry, we seem to be having another technical difficulty. Let's just see if we can get Lou back on board, because I have no idea about birthing reflections, and this bit was going to be good.
Yeah.
Continue with our guest. Sorry about this, people. Won't be a second. Just see if we can add Lou again.
Hello.
Hello.
My cousin just tried to phone me, and I turned behind the call, and then it all just went really funny. So please don't call me again, Pauline.
Sorry, we got into the birthing reflections part, and you were just about to go into it.
Although it's actually made my headphones sound a lot better. I can hear you so much better. So maybe something's changed. So yes, birth reflections is for anybody who feels upset or traumatized or confused by their birth experience and want to talk about it. And so for some women, it can be certain aspects of their birth they're really unhappy about, or it could be lots of different things, or they just have questions about why things happened the way they did. Sometimes it's often women can feel really upset, and then because they've got so much to do with looking after a baby, they sort of put it to one side and just kind of get on with things and deal with it. And it's usually when they think about having another baby or they're pregnant again, that's when it all comes flooding back. So the birth reflections with me is to talk through what happened last time. If they have specific things they want to do in this pregnancy, so if they've got a specific birth plan or how they'd like to deliver the baby this time, then I talk them through their options. If they want a specific delivery, I talk them through what they need to do to get through. But it's just about answering those questions and trying to make it clear what happened and why it happened, and try to do as much as I possibly can to guide them in the right way so that things are a better experience this time round. We can have the hospital notes, and when I used to do it as part of my NHS job, we always used to have the hospital notes there. And so I do ask the women if they want to have the hospital notes, we can go through them. But I have to say, a lot of the time, unless it's really specific, we can just talk through the actual process, what happened, without necessarily needing the notes. I certainly do say to women that if it is really specific to that unit, so it's a particular member of staff or a couple of members of staff, then I would suggest they go back to the hospital, because most hospitals do offer it as well. But if it's quite specific to the unit or the staff, then I do say that they recommend to go back to speak to the hospital as well. But if it's a general talking about birth and looking at the next pregnancy, looking at the next birth and planning, then that's, I'm your lady.
Good, good.
We have got another question in from Alison, who asked, what do you enjoy most about the one-to-one classes?
I enjoy that one-to-one time with the couples, because you get to properly get to know them in it. Whereas when you teach group classes, obviously you're trying to get to know everybody and making sure that everybody in that group gets a bit of your attention and just make sure that they get all their questions answered. Whereas in a one-to-one, they can ask whatever they want to, so you kind of really get to know them. And I just find by the end of it, I just feel like they're sort of friends and we've just had a chat for a few hours. It's really nice, and I like to spend that time with them. I like seeing the difference. So at the beginning of the class, where people might be quite fearful of certain things or nervous about certain things, and then seeing them at the end of the class where they're feeling much more confident and much more happy with the process and kind of looking forward to it. That's what I like. And the best bit about all of it, the best bit about all of it is hearing back from them afterwards. I absolutely love hearing back when they've had their baby and seeing pictures and how it went. That makes it all worthwhile.
Because I think that's amazing. I think again, from the male side of thing as well, just for us going into antenatal classes is awkward. Lads. We just want to, we don't want to. I'm not saying we like that, but we're more awkward about that. Do you find that the fathers as such relax a lot more and show more interest within a one-to-one session?
Yeah, definitely. And I've actually had quite a few times that it's actually been the male partner or the partner that's actually contacted me to try to book the classes. And when I've gone round, and I always try to ask if I remember where they've heard about me, and often it's the fathers kind of saying, I wanted to make sure we didn't go to a group class. I really wanted someone to come to the house. So often it is them. But I think, for men particularly, it can be quite daunting going to a group class, whereas often the women, I don't want to generalise, but it's often the women that want to go to make friends, because generally, not always, they'll be the ones off with the babies when they've had the baby. So I suppose they want to make some contacts and friends for them. But usually for the men, it's usually about finding out the information. So, the men tend to prefer it.
Yeah. I would have. It was
not a generalisation, of course, but yeah.
No, exactly. And I'm only talking from personal experience. It was awkward. What are the groups? So to be able to, because it's important to have that group around you afterwards, isn't it, with people similar, that sort of things. Where do people find those groups? So I'm sure there's Facebook groups and stuff like that. Where else could people go to find people that's in similar situations?
Well, I've often found that people that do come to do one-to-one classes with me already have their support group around them. So the last class I did a few weeks ago, there was like 5 of their friends that were pregnant around the same sort of time. So they didn't feel that they needed to find more friends as such at that moment in time, because they felt they had enough family support and friend support around them. But there are lots of places in the community that, as you said, Facebook, there's lots of groups. Your health visitor should be able to point in the right direction about certain classes that they do at their children's centres. And myself, am hoping to finally start a meetup. So it's something I wanted to do when I started my classes, so that you can have a one-to-one with me and then have an opportunity to meet other mums.
Yeah.
So I'm hoping to start that in the next few weeks. So watch out, St Albans. So kind of get mums meeting up together somewhere. So I'm hoping to get that organised. I've been speaking to a few of my mummies that I've already had classes with to see if they be interested and want to come, and then I'll put it out there for everybody. But if and when I do start the meetup, it'll be open to everybody. So mummies, daddies, aunties, uncles, grandparents, anyone who's looking after a newborn or a toddler or who's pregnant is more than welcome to come and join us and have a cup of tea.
Nice. I feel really calm talking to you. Like Rebecca says, definitely would have hired you for 9 months. So
Thank you. I'll give you that money afterwards.
This is free, by the way. We're not charging. We're like supermarkets. We're allowed to advertise whoever we want. This is just about. So we're almost out of questions that we've got so far. Here we go. Was there anything more from?
Nothing at the moment, no.
So looking at the whole process, can you give a little run through them? So can you give a little run through of some of the milestones and actions that can be expectant parents should be taking, and any kind of good books that you would recommend or anything like that?
Again, I would kind of recommend that they go with the hospital website or trusted website if they're going to kind of read and around pregnancy. There are some really good books out there. I can't honestly think of it off the top of my head right now, which is really bad. But it is certainly getting booked in with your midwife early, attending all your antenatal appointments, attending your antenatal classes, getting your bags packed and getting bits together throughout the pregnancy. I mean, one of the greatest tips I think is to try and get things bought throughout the pregnancy. So things like nappies and wipes in particular are really expensive. So, you know, if you kind of keep an eye on your supermarkets and whenever they're doing a deal on baby products, and that's the time to kind of go and bulk buy bits that you're going to need for the long term. And where possible, trying to save the environment. If you can buy things that are more eco-friendly, then by all means, there are lots of companies out there that are doing biodegradable wipes and nappies, and there are some councils that are still doing the washable nappies, where they come and take the nappies away, wash them and bring them back to you. So there are lots of other alternatives to nappies, and hopefully all the big companies in the next few years will start making sure that their nappies are a bit more biodegradable. But certainly buy things, you know, small throughout the pregnancy. And if you're going to have a baby shower, that's the kind of thing to get people to buy you. It's the practical things you're going to need. So nappies and wipes and baby grows and muslins, the things that go over your shoulder, cloths, so you kind of never have enough of them. And then for clothes for different stages, because people might tend to just buy you newborn, and of course they grow so quickly. So it's about having different
£10 and you don't even get to use them. That's
and then you don't need the newborn at all. But I had clothes for different stages. So that's my advice. It is just kind of keeping your antenatal appointments and try to enjoy it. You know, it's a really exciting time. It's a lovely time. So as much as possible, if you're having a good pregnancy, there are people that obviously have lots of problems and issues and symptoms and things of pregnancy, but as much as possible, try to enjoy it. It's generally a lovely time.
Can I just, Danielle's asked a question. I'm really going to show that I've got no clue what's going on. She said, so are there any benefits of going for a VBAC after a C-section? So I hope you know what that means.
Yes, I do indeed. That stands for vaginal birth after cesarean section. And so obviously women can have cesarean sections when they're in labour for lots of different reasons. So sometimes it can be that perhaps baby didn't like labour and got distressed and needed to come out. And if your cervix is not fully dilated or 10 centimetres dilated, then the only way we can deliver the baby is by cesarean section. It might be that perhaps your cervix just hasn't dilated and hasn't opened enough, and so we just can't get you to 10 centimetres for baby to come. So for whatever reason, with the next pregnancy, it doesn't automatically mean you have to have a cesarean the next time round. A lot of it will depend on why you had the cesarean the first time, but certainly if there's something for a terrible phrase of what we call failure to progress, which is just a terrible phrase. It just means that things didn't progress in labour, or that perhaps baby got distressed, and they're obviously things that would allow you to go for a normal delivery the next time. And obviously the advantage of having a normal delivery is the recovery is so much better. Obviously, if you have a cesarean section, it can make it harder. You're not really allowed to pick up anything heavier than the baby. It can actually be quite hard to bend down and pick the baby up. Your recovery can be a lot slower. You can't drive for a few weeks afterwards, and that depends. That comes down to insurance companies. So it's usually about 4 weeks or so afterwards you can't drive. And so having a normal delivery tends to be much better for women in terms of their recovery and being able to look after their baby. And particularly if you've also got a baby or a couple of babies to already look after, you want your recovery to be as quick as possible. So you can go for what we call a VBAC. I offer VBAC classes. Most NHS hospitals will probably offer VBAC classes. And that's just to kind of talk through your options, and again, just kind of the sort of refreshers as well, but also geared more to trying to help you get a normal delivery. And particularly it depends on, you know, how many children you want to have. So if you want to have, if you had a cesarean section for your first baby, but you'd like to maybe have 3 or 4 children, then having 3 or 4 cesarean sections isn't ideal either. So, you know, for those women who want to have a bigger family, certainly having a vaginal delivery the next time would be ideal. However, if women want to have elective cesarean sections next time round, then, you know, that's something that the hospital will be able to do as well. But yeah, I think having the opportunity or trying to have a vaginal delivery afterwards is really important. And that's often what women want to do as well.
Good. great answer. Danielle's also said self-care for new mum is really good. I'm assuming that's going back to the book, which then talks about the 4th trimester and looking after yourself is really helpful. So thank you, Danielle.
and that's really important.
And the lovely Tracy Ross has also commented on there, just saying you're so right about focusing on buying what you need as you went through.
Hello?
Yes. Someone just called me.
Oh, no.
So that's why, and I was like, well, let's get them off. And I come back and you were frozen. I was like, oh no, we're good. So sorry. Thank you, Tracy, for saying about focusing on what you need to be able to being able to focus on buying what you need. I'm almost out of questions. We're doing really well because we're only 13 minutes away. Anything else that you would like to add? I love putting you on the spot.
Yeah, I know.
You're amazing, by the way. You are so calming and so knowledgeable. And it's just when you speak to an expert that you only need to know a little bit more than someone else to make you an expert, is what they say, isn't it? But you know all of your stuff, and you are so calming. And I've really enjoyed this chat.
Well, I'm glad I could come across as calm, because I wasn't calm just before we started.
I feel like when we're having a massive meltdown in the office, we can just ring you.
Anytime. That's
so we're having technical difficulties like we did at the beginning.
I think the technical difficulties actually helped, because then after a while I was like, I just want to get on with this now, get me on there. So actually I think it kind of got rid of my nerves. I'm sure you probably did that on purpose. Although it was me not getting on there, wasn't it?
It's fine. Ben was here to sort us out, like he always is.
Thank you, Ben. Ben's amazing.
He is amazing. He is amazing.
He is, yeah. So we've just had a question in from Carly. So she said, is there any support out there for mums that have been through a traumatic labour? She had a really bad time with her first, and it really petrified her when she had her second.
Well, that's exactly what my Birth Reflections is all about. So it's about being able to sit and talk through women, and what's really important doing it, and what I always say to them, is that make sure that we go through it in their time and in their pace. So if that sometimes takes 2 sessions to kind of sit, because sometimes women are so traumatized that revisiting it is really upsetting, but it's really important to kind of talk it through. So if she wants to contact me afterwards, I'm happy just to give her a quick call if she wants to talk things through. But it is important to sit down and spend that time and go through and exactly what happened and why it happened, because often first babies tend to be the worst. They tend to be much longer and tougher labours. Usually second time around things tend to be much easier, and so often what goes against you is the fact that it was a first time labour, and those things do take time. But it is important to sit and talk it through, because I've seen women and met women who are, you know, in their 40s, 50s, 60s that still feel traumatised by their birth experience. Which is quite sad, really. So yeah, if she wants to talk about it, please contact me afterwards. I'm more than happy to sit and go through it. But it's really important, because again, if you're stopping you having another baby and you want to have another baby, then it's really important to talk about it.
Yeah, nice. Thank you. We've got another one come through.
So no, Danielle's just said she thinks the Birth Reflections could be really useful for mum's well-being and mental health as well.
Definitely. Yeah, absolutely. Yeah, it is. And it's just about giving them the confidence of, you know, what happened. Because often women, I mean, I've met mums before at home where they think they've failed. And, you know, how can you ever fail having a baby? You've produced a little human being and gave birth to it. So, and doing all the best to look after it. So, yeah, it can be just a real confidence boost to women as well. Just that actually you're doing a great job. You did a great job. And maybe things didn't go quite as to what you expected. But, you know, talking it through really can help and get you prepared for next time.
Nice.
Thank you. I was just going to say, I am going to put all your contact details at the end, and we'll tag in your page as well, and website and everything. So all your details will be on there. And we are going to put this video on our page. When I say we, Neil's going to put this video on our page.
So what we'll do is, once the video's been out, we'll post it straight on our page. We'll download it. We'll send it to you. You can put it on your page as well, so then people have got to be able to do it, and then we can chop and change it if need be to get the actual specific questions out for people. But I think it's been really beneficial. You know, I think it's good that people can jump on and be able to speak to someone like yourself, and just in a nice, calm manner, and just have those questions answered, because it is the whole thing around pregnancy is difficult to understand, and like you say, there's the trauma inside, but you should enjoy it. It's a magical time. It's a really important time. So I think it's good that you've clarified that and got that out now and clear. I think the whole birthing reflections, and just to see from, you know, because I know it is a traumatic time sometimes going through that. And I can tell you from a male's point of view as well, we are
Yes, yeah,
useless.
absolutely.
We are helpless. We just don't
No,
know what to
you're
do. No, but I just mean though, we go into those modes where you try and be supportive and stuff, but actually it's difficult at times to be able to know what to do and stuff. And yeah, how do you help the fathers through during sort of labour as such?
Well, during labour, I mean, obviously it's keeping them involved, and if they know what, again, it's talking about the birth plan and talking about things that you wanted antenatally between the couple, really does help when it's in labour. But it is about keeping the partner involved and involved in all decision making that needs to be made during labour. I did meet a dad recently actually who said that his children were probably the same age as yours, and he felt really traumatised by the birth experience, and to the point where he, even talking about it, you could just see the tears coming into his eyes. So I'm always happy to talk to dads. I've been to birth experiences before where it's just the woman who wants to talk. And although I always offered that if they want to have their partner there, they're more than welcome to, the majority of the time the women have said that they'll talk to me and then translate any information to their partner. But I've always said if they want to talk to me or contact me afterwards or anything, then they're more than welcome to. But I often find it's mainly the women who want it, and the men kind of think the women need to have it. Yeah. But actually sometimes they need to have it as well.
Yeah, I think it's... Oh, we've got another question coming in.
It's not a question. It's just a lovely, lovely testimonial. So it's from Natalie Atkins, who you will know, and it will become apparent.
Natalie, hi Natalie.
So she said she had a birth reflection with you after they had their daughter, and she can hand on heart say that their second child wouldn't be here without your support.
Oh, thank you, Natalie. And I've met her second baby as well, and oh, it's so cute. And hopefully I'm going to see her on Monday, I hope. So.
Good. So I think we're almost there. Is there if there's any other questions to come through? I just want to say thank you so much for coming on and being able to do this and being available to answer any questions. It's great to be able to speak to an expert. We work with you. We love your work anyway.
Thank you.
What we'll do afterwards is we'll put all of your details, all of your links on our page. We'll send the video over to you so you can put it on yours as well. But if anyone wants to get in contact, I know that you've said before, feel free to drop her a message.
Yeah, absolutely.
And go from there. But otherwise, all of your classes, all of your details are on your website.
They are indeed.
Yeah. Them on there. And the Facebook page.
And the Facebook page.
As in Louise's Facebook page.
Yeah. So, anything from you at all?
Well, one last thing just to say that obviously once you do have a baby, it's really important to think about your life and your wills. And it is really important, but genuinely it really is really important to kind of think about, what would happen if something happened to you and your partner. And particularly once you've had a baby, that often really comes to people's they're into the priority in their lives. I mean, even if you've got dependents, whether that's kids or your elderly parents or your pets, my little cat was just running around here, it's really important to kind of get those things sorted. So, Leah and Neil are your people for that, but it is important to kind of get those side of things sorted. As who would look after your children if something happened.
Thank you. I think a lot of
You're welcome.
People, for me, when I was always immortal, especially up until the age of 21, and then all of a sudden when I got to 21, I was like, I'm not responsible for just me anymore. I'm responsible for other people. I think that's what a lot of people do come to us regarding. But thank you for the shout out. So
you're very welcome. But it is true.
Yeah. We're all good. Thank you so much for joining us. Thank you everyone who's still on the live. Really appreciate
so much for having me.
You're welcome, most welcome. And we will be doing more TLC talks too. We've got the lovely Tracy Ross talking
who's live with us.
Who is live with us? Who's a good friend of yours as well. So we'll talk about this to be organised next, so the details will be following. But just to say thank you again to you.
Yeah, thank you.
You're amazing, and thank you for everyone for joining us. All right, take
Thank
care. Have a good evening.
Bye.
See you later. Bye.